found it interesting all the voting regarding the place to use the adrenaline pen, and I find it also interesting that some people find it still so confusing about what is the place to use it and if it is compulsory to use it just on the leg or not. So, and what I find interesting is also that I have people that deal in analogy between parents and healthcare professionals voting both sides. So let's try to explain a little bit more about that. And by starting to answer your question, is it always compulsory to use the leg as the choice to use the adrenaline auto-injector? The answer is no. You should do, and the reason for that, and that's why you need to understand why do we choose the leg. First of all, easy of access. It's there, very easy. It's probably one of the easiest places for you to do. Is at arm's reach, really, and I'm going to show you soon how that works. But also size of it. It is a very, very big muscle. So basically you cannot miss it, and we need to be sure that the adrenaline is injected into a big muscle for it to get absorbed. And then associated with this absorption is also the amount of blood vessels that it has. So if you can imagine, because the muscle is so big, the amount of veins and arteries, mainly veins, that the quad or quadriceps has is very, very big. That means that adrenaline soon will be drained into small blood vessels that get bigger and bigger and bigger until it gets to the femoral vein. Femoral vein brings it up to liver, passes up to the heart, and it goes all over the place. And that is the main reason why we should go for something like that. So now, can we use it somewhere else? Yes. There's several conditions in which we need to consider that we cannot use it on the leg. Now, let's think about simple things. For one reason or another, and I'm not going to even talk about some very silly ideas from Hollywood movie style, is what if the leg is not available? If you cannot inject it into the leg, what should you do? You need to inject adrenaline anyway, so how are you going to do it? So you need to choose what are the best things, the best next muscles that you have. So size-wise and vascularity-wise, so veins and arteries-wise, what should you go? We go for what we call, in medical terms, the gluteus muscle, so bum. And if you think about, we think of the muscles that we often also use to give any sort of IM injection. And if you think really carefully, in children, sometimes it's not just the leg that is used. So the bum is used also very often. What is the other third muscle that can be used? Third muscle, shoulder. Shoulder is also a very big muscle, but again, think about ease of access for you to get into that one. Of course, going into the leg, it's easy, there, straightforward, but to go into your bum, the movement of going behind and do it is not as natural. You need to flick it away and do it. On the shoulder, actually, ease of access is easier, but again, you can see that it's not a very natural process to go there. So remember, these three muscles can be used, though the quad is always the first choice. Now, let's talk about a bit of mechanism and how shall we do it, because very often there's also that confusion about how to do it, how not to do it, the place to do it and not. But also because I've also told you about two other muscles where you can do it, you need to be very clear of where can you do it or not, because it's not the entire muscle, like in the leg, it's not the entire muscle that you can use. There's a specific area that you can do it, and I'm going to tell you soon. And for that, we're going to need this. So, let's learn how to do this one. This is a training pen. I'm not going to inject myself with a real one. I wouldn't like to do that, and none of you probably would like it as well. So, first of all, and before I show you where to do it, how do we hold it? Hand. My hands are big, so I probably will take most of it. Middle of your hand. There. Hold it. See? Space both sides. Okay? So, where? Let me show you now how it is, because it's very important for you to see where in the leg should you inject this one. Okay, so standing up, imagine your leg from there to here, and you divide it in three: 1/3, 2/3, and the last third. So there, this is the front of your leg, this is the side of your leg. If you pull it that way, imagine this, more or less in between your fingers, there. Okay, remember, hold it properly, cap off, do not swing it. If you swing it very often, it will bounce back. Just go there, where we decided that is going to be, see there, and just simple movement, because there's a coil inside that is going to fire the needle inside. See, you listen to the click, that is the needle coming out. In case of the EpiPen, you count to 3 seconds. After 3 seconds, out. This will cover the needle that came out. Okay, remember, any of these is single use only. Okay, now let's see the other one. Again, training pen. As you can see, this is a Jext training pen. The principle is basically the same as before. Hold it in a way, space on one side, space on the other side, your hand stays in the middle. Okay, remember that I go standing up again. Remember the place there, cap off, don't swing it, simple movement. Noise again of the needle being fired. In the case of a Jext pen, you need to count to 10 seconds. After 10 seconds, out. That's the thing, the same thing, the same principle, just a little bit longer. Okay, I'm sorry I don't have an Emerald training pen. I think I've used a few of them recently, but the principle is going to be the same about how to use this. So, do you understand now how it is? Also remember another important thing. If you need to use this, either one, more than once, do not inject it on the same place as you did before. Main thing is, use it on the other leg. And if you use it on the other leg, the principle is going to be the same. If you cannot use it on the other leg, then what shall we do? Use it lower down. Okay? So now I'm going to come back to what I said. Why do we use other muscles? Remember I told you that one of them is if the muscle is not accessible. Now think about other, which are a bit extreme, but I have a couple of patients like this. Imagine someone that is an amputee, so they don't have legs. Then what? They need to choose another muscle. And where is the other muscle that they're going to go? As I said, gluteus, so bum, shoulder. Okay? Other condition. Imagine someone that for one reason or another, there's significant muscle wasting. And you see a lot of Paralympics, for instance, that they are paralyzed from the waist down. They don't have a lot of muscle. So then what? They're going to have actually quite big muscles. Sometimes their bums are going to be quite big, their buttocks are going to be quite big because they put a lot of pressure into it. But also, what is going to be the next one that is going to be very, very big? Arms and shoulders. Perfect place for them. Okay. Imagine also people with other more significant muscle wasting, like children with cerebral palsy, that for one reason or another, the muscles are not developed or did not develop like in anyone else. In that case, you need to choose another one. Okay, so remember, in medicine, nothing is ever absolute. Medicine is not an accurate science. It's not like the mathematics and physics and all that. We need to adapt to the individual case. In medicine, there's never a one size fits all. Okay, we need to see that patient and what is the best for that patient. And if that patient for one reason or another cannot use their adrenaline on a leg, we need to choose what is the next best place, because otherwise what's going to happen if they have an anaphylaxis? Then where are they going to do it? Are they going to wait for someone to come put an IV access and give us anaphylaxis by adrenaline by the vein? We cannot wait for that. We need to choose the next best thing. I hope that this clarified, and I'm going to show you a couple of images in which I'll show you exactly where the spot is for the gluteus and for the shoulder where you could use it. Basically, normally what we use is what is called the upper external quadrant. So it's like imagining that the muscle is divided into four, and you choose this side, the upper external, this side there, the buttocks, not going to show you my bum, is going to be also upper external, but I'll show you some images of that. I hope you enjoyed it.